You good to go, Carlos? Great. Okay. Hello, everyone. Welcome to Farmworkers 101, presented by the National Center for Farm Worker Health. We have three speakers for today's session. Myself, my name's Katie. I'm the lead project coordinator for public health programs here at NCFH. I'm joined by my colleague Carlos, our communications manager, and Vivian, our language access coordinator. And we have three learning objectives for our session today. So by the end of the session, you'll understand the critical roles of farm workers and the role they play in the U.S. economy and public health, including their contributions to agriculture and their vulnerabilities to infectious diseases like H5N1 avian influenza. We'll also share about foundational knowledge of the agricultural industry, including its structure, occupational hazards, labor systems, and the demographic characteristics of the farm worker population. And we'll talk about the barriers and facilitators that influence farm workers' participation in public health surveillance and their access to healthcare services. For those of you who may not be familiar with the National Center for Farm Worker Health, NCFH, we are a private nonprofit organization located outside of Austin in Buda, Texas. And our mission is to improve the health of farm worker families. And we do this by providing services across four main areas: capacity building, health promotion and education, farm worker outreach, and research and data collection. And through our outreach and research and data collection, NCFH currently has H5N1 and COVID outreach partners across the country in 21% of US counties. This map shows a visual of our partners across the United States. So to get the session started, we're going to start with some foundational information on the history and structure of US agriculture. So first, we're going to take a look back at the history and some key legislation. The U.S. has relied on immigrant labor for agriculture for centuries. And by the mid 1800s, as farming expanded, agriculture labor became essential and drew workers from all over the world, from Europe to China, Japan, and Mexico. During World War During World War I, labor shortages led to the Immigration and Nationality Act of 1917. This allowed Mexican workers to fill the agricultural labor gaps. Then between 1930 and 1936, the Dust Bowl occurred, which displaced farmers, leading many farmers to migrate for work, and also led to the deportation of thousands of Mexican laborers that came in to fill the labor shortage during World War I. The Farm Security Administration provided aid during the Great Depression, but had limited impact on migrant workers' health. And then in World War II, labor shortages occurred once again, leading to the Bracero program, which began in 1943 and went all the way through 1964, which brought millions of Mexican laborers to the United States. In 1952, the Immigration and Nationality Act introduced the H-2 program for foreign workers, which remains in place today. In the 1960s, we saw major labor reforms, including the formation of the National Farm Workers Association, the end of the Bracero program, and the extension of minimum wage protections to farm workers. During this era, we also saw expansions in the migrant health and education programs, which included the development of the Migrant Health Program and the Migrant Education Program. Then in the 1990s, the Health Center Consolidation Act streamlined federal health programs and funding, aiming to improve access to care for migrant workers. So I'm going to pass it over to my colleague Carlos to talk a little bit about the structure of labor among agricultural workers.
Thank you, Katie. So understanding the agricultural labor structure is essential. for healthcare providers and organizations because it reveals how actually farm workers are employed and supervised in agricultural work, which directly impacts their ability to access healthcare services. Now, when we understand who employs farm workers, whether directly through agricultural employers or through farm labor contractors, we can better develop strategies to reach and serve this population. Now, the agricultural labor structure refers to the organized system, as you can see here in the slide, of relationships and responsibilities between the key entities involved in agricultural work in the United States. It outlines how agricultural work is organized and managed. It defines who employs farm workers, either agricultural employers directly or through the farm labor contractors. It establishes who oversees workplace compliance, which are government agencies, and then it clarifies the channels through which agricultural labor is coordinated. So this is structure makes sure that agricultural operations run effectively while maintaining proper oversight of worker rights and safety. Now, let's talk now about the agricultural industries. So we're going to actually move to the next slide. So when we talk about agricultural industries, it's important to actually understand the differences among them in order for us to actually then know exactly how to develop the strategies in which we actually are providing healthcare access to farm workers. So we'll start with the crop industry, which means this the cultivation and harvesting of products such as fruits, vegetable, grains, and other plants. Then we actually talking now about the dairy industry, which actually farms that are focusing on milk production and processing involving the care and milking of cows. Now, goat and sheep industries operations actually that raise goats and sheep for their meat, milk, wool, and other products. And then we have the poultry and swine. These are the farms that are actually dedicated to raising chickens, turkey, pigs, and other fowl or pork for meat and egg production. Now, meat packing, though, is a little bit interesting, right? These are facilities where livestock are slaughtered and processed into meat products for distribution, but it's actually important to mention that they're not an agricultural industry, but it's related to agriculture. It's technically part of the manufacturing industry. This is important because actually meat packing workers earn overtime while farm workers do not. And now, I'm going to pass it to my colleague Vivian. Let's actually move to the next slide here, who's actually going to be talking about who are farm workers.
Yes, hi everyone. I would invite you to just take a close look at this picture. This was taken by NCFH staff. And, one thing that we might be surprised by is the fact that women are farm workers. And you can go to the next slide and actually make up about 1/3 of the farm worker population. They're I don't know if you can see it, but they're picking nopal or prickly pear. And we'll speak a little bit later about the different dangers and health risks involved with farm working. Other key demographics is that about 2.5 million people are farm workers, estimatedly, and about 44%, or almost half of them, are between 20 and 34 years old. And more than 70% of farm workers earn an income of less than $30,000 per year. And of course, this is very important information because with limited income comes limited opportunities to seek out help. I also did want to mention that these are estimates because it's very difficult to collect accurate data on agricultural workers, partly because of their constant mobility, partly because of the many languages that are spoken. So we can assume that there are folks that are left out of this count. And we would also want to remember that if we include farm worker families, we're talking about more or less 4 million people in the US. Okay. Oh, and one more thing regarding families is that we don't have really good data on the number of children who work in agriculture. But there are a number of reasons farm worker children may work in the fields, including to supplement their family income and lack of childcare. Okay, next slide, please. So NCFH really focuses a lot on farm worker language demographics. And we do this because it's just such an essential element of access to healthcare. People can get healthy if they speak the language of their healthcare professionals. And if there's a language gap there or a cultural gap there, of course, it's much harder to access health. And you might be surprised by some of the languages. These are some of the top languages that come up in our language surveys. So of course, Spanish and English are primary. But then there's also a really large number of farm workers who speak different indigenous languages of Central America and Mexico. An example would be Tzotzil, which is a Mayan language, mostly spoken in Chiapas. But there are another 22 or so Mayan languages spoken in Guatemala, as well as languages that you may have heard of like Zapotec or Mixtec. There are also a lot of speakers of Haitian Creole, working as farm workers, and Afrikaans is also for a good, I want to say more than 5 years now, has been more and more spoken among farm workers in the United States. Next slide, please. Now this slide is actually going to let y'all hear the English spoken by two Afrikaans speaking farm workers. And I'm going to tell you a little bit about what they're saying. This is just a snippet of an interview we did, because probably you wouldn't understand what they were saying if let's say they just walked into a health clinic and started speaking in English because of their accent. And of course, this is a sort of reminder that there need to be procedures and processes in place in order to, interact with folks where you might not understand their accent, or they might not be speaking English at all when they call or when they walk into a health center. So these two young men are talking about what happens when it rains in the fields where they work, and that ruts develop, and so they will actually not be able to work because of the way that it can damage the fields. And then they also just talk about a typical work day and how long a typical work day is for them. So you can go ahead and play the video now. Thank you, Katie.
It differs time to times. If it rains, we off because then we can't get into the fields to work because it's too wet. Trucks and stuff get stuck and you rut up the fields. But on an average day, we don't work less than 15 hours on a good day to get the job done. And then in 7 days.
So next slide, please. So as I said, it's important to have materials, and there are free materials available on the internet, such as I Speak materials or language identification cards, so that you can quickly figure out a language that a farm worker speaks and not delay their care in the context of a clinic. This next slide is about the different types of farm workers, and this kind of demographic information is also very important in terms of facilitating access to care, because all these different types of work imply different determinants of health. So first we have the seasonal workers employed on a seasonal basis, and often during peak planting and harvesting times. So obviously that is not necessarily steady work and involves a lot of moving around. So these might be folks that it's important to identify because of a limited time frame in which you would be able to address their health concerns. Migratory workers as well. They may follow crop cycles. Again, you would need to have like a broad concept of how they're going to get health and access to health in the different places where they migrate. H2A guest workers, which we mentioned in terms of the legislation. These are foreign nationals who have visas to work in agriculture on a temporary basis. And then permanent workers, and these are folks who are employed in agriculture year-round. And this may be, for example, in livestock or equipment operation. Thanks. I will now pass it over to my colleague, Carlos. Oh, no, excuse me. Next slide, please. So to wrap up my section of the presentation, I'm going to talk about strategies for facilitating healthcare access for farm workers. And one of just the most basic strategies is just awareness, staff awareness. Sometimes in a clinical setting, if you haven't trained your staff, they might not realize that the person that they're treating is a farm worker and have specific determinants of health because of the nature of their work. And there is a link there, the farm worker language map that we developed here at NCFH. So you can get a sense of in your area what languages are spoken by farm workers. Another strategy is language access. So having written and spoken translation, or also called interpretation services, available. And this is really important for conversations that involve farm worker safety, making sure that they are able to understand you and vice versa. I mentioned language identification materials. I Speak posters are available for free at national, state, and sometimes at local levels. And there's an example there from the state of Oregon. And finally, staffing, being able to recruit bilingual and bicultural staff in the languages and cultures spoken by local farm workers is an incredible asset to providing access for farm workers to health. And now I will pass it to my colleague, Carlos.
All right, thank you, Vivian. Okay, now let's talk about migration trends, which is, I think, is a very interesting topic if we're trying to understand how actually farm workers move across the country, in order for us to actually provide better access to healthcare. So there are three traditional mainstreams of migration for farm workers in the United States. As we see here is Western, Midwestern, and Eastern. As shown on the map, California, Texas, and Florida serves as common starting points for migration within their respective streams, with farm workers sometimes actually moving across the country following crop harvest and employment opportunities, as Vivian mentioned in her slides. Now, the proportion of farm workers who migrate within the US has actually significantly decreased, with a 60% decline since the late 1990s. Now, why? Well, we actually have more year-round farm jobs. What that means is actually some farms now grow crops that need workers all year, so workers don't have to move as much to find jobs. Another reason is that the proportion of higher crop farm workers considered settled, working at a single location within 75 miles of their home, increased from 41% in 1996, 1998 to 83% in 2020 to 2022. Also, the H-2A visa program actually brings in more foreign workers on temporary contracts, and then they must stay within one employer so they cannot move around. And we'll talk a little bit more about that in the next few minutes as well. Now, the H-2A impact, I think it's important that we understand this as well, is because between 2017 and 2022, the number of certified H-2A positions increased by nearly 65%, from approximately 225,000 to over 370,000 farm workers. Now, in the fiscal year of 2024, 384,900 H-2A positions were certified nationwide. What that means is actually these jobs were officially approved by the government, allowing employers to hire foreign workers legally under that program. So this number represents a record high in H-2A usage, reflecting the increasing reliance of U.S. agriculture on foreign labor. Now, we're going to be talking about, as we continue with the slides, and why these actually migration trends are very important. So as you know, there are different reasons why actually farm workers move across the country. The H-2A program is actually one of them as well in terms of why they actually come to a certain states or certain areas. And that has a lot to do with the employers actually sponsor them, actually bringing them over. But they have to prove, as it was mentioned at the beginning of the training, that there is a shortage of labor in order for them to actually bring foreign workers into their farms. Now I'll actually pass it on to my colleague, Katie.
Thank you, Carlos. In this next section, we're going to take a look at some of the occupational and environmental risks that farm workers experience. So now that we have a pretty good idea of who farm workers are and the different types of agricultural labor, we're going to look at what risks they experience as farm workers. So starting with working conditions, there's a lot of fluctuation in employment for farm workers for a number of reasons. Availability of work can depend on season, weather, and market demands. Hours can be very atypical and fluctuate. They can be from very early in the morning to late in the evening hours, or they can be done every day versus 5 days a week. There's also various ways that farm workers receive their income. Some are paid by the hour, some are paid by the piece picked, depending on the crop that they're working on, and some are salaried. 86% of agriculture households reported not receiving a benefit of a needs-based program in the past 2 years. So the majority of farm workers do not receive benefits or are not able to access them. Looking at housing conditions, 26% of farm workers report living in a crowded housing situation. Adequate, affordable, and safe housing has been and continues to be a consistent struggle for migratory and seasonal farm workers. There are a couple of ways that farm workers meet their housing needs. About 14% of farm workers may receive housing provided by their employer. This is often the case for migratory workers and H-2A workers, as Carlos was mentioning, given that they travel for work and their employer for the H-2A program is required to provide them housing. Housing provided by employers is traditionally met by developing a labor camp, and the construction and maintenance of these housing situations can be very expensive for employers, and which is disincentivizing for employers to make sure they are a good accommodation for farm workers. Especially given that farm workers aren't living in them year round. They may be there for short harvest seasons. And so sometimes, and most of the time, this housing can be very substandard. Another way that farm workers find housing is through rental properties. Most farm workers do not have their housing provided by their employers, so they have to find housing on their own. This is about 50% of farm workers. However, in most rural communities, rentals are difficult to find. It's also difficult for migratory groups to provide long-term rental commitments and leases due to the nature of their work, only being there for a season. So it can be difficult to find rental housing. Also, in this situation, often migrating farm workers and their family members may live with other migrating farm workers and other families, which can lead to crowded housing situations, which makes it really difficult when we're struggling to control infectious diseases such as COVID, to practice social distancing. Um, so that can be a housing risk. And about 35% of farm workers own their own private housing. This is often the case for settled out seasonal workers. Um, and again, in this situation, we also see, given the expensive housing costs, we often see multiple families, multiple generations living in housing together. Um, and some common illnesses related to housing. We'll mention throughout these next few slides what some common conditions, illnesses, injuries related with the farm worker experience, because it's really important from a health center or health department perspective to be familiar with what issues and conditions farm workers may be experiencing, so that we can have proper diagnoses, proper treatments, and proper connection with the programs and resources they need. So, related to housing, some of the illnesses that we see are UTIs and intestinal parasites, various skin conditions, respiratory conditions, and especially in the crowded housing situations, increased risk for infectious diseases. So in this slide, we'll be looking at occupational risks. Agriculture is consistently ranked as one of the top dangerous occupations in the United States. There are a lot of risks related to the way that the work is set up. Farm workers are doing a lot of repetitive motions and heavy lifting that can lead to musculoskeletal injuries. And they're also outside all day. So weather plays a big role and can contribute to heat stress and dehydration. They're also at a higher risk of insect, rodent, and snake bites due to being outside in the fields. Additionally, as I mentioned earlier, some farm workers are paid by the piece picked, which is called piece rate wages. So in piece rate wages versus receiving an hourly wage, it encourages farm workers to work longer, harder, and faster without taking breaks in order to earn more income. So this practice can really not allow farm workers to take breaks that they need to rehydrate or to take care of their chronic illnesses, or to take a break to go to a medical appointment. So this can really be an occupational risk for farm workers. Um, Also, the lack of safety precautions in the workplace can be a hazard and risk. Especially, we saw this highlighted during when the COVID-19 pandemic began, and the lack of personal protective equipment, the lack of ability to take time off work, social distancing, lack of hand washing stations. Farm workers, really a light was shown on them being an essential component of essential workers, an essential component of our society. And it was very apparent the lack of support that they received during the pandemic. This slide highlights some of the environmental risks. We've touched on a number of these, But the direct contact with plants and crops puts farm workers at risk of um, coming into contact with pesticides and chemical fertilizers. There are also some plants and crops that release chemicals that can be toxic to humans and cause allergic reactions. Um, and these contaminations can lead to a number of illnesses, intestinal illnesses, conjunctivitis, and other issues related to chemical and pesticide exposure. The Environmental Protection Agency estimates between 10 and 20,000 poisoned farm workers per year. And the reason why that range is so big is because often pesticide and chemical fertilizer reactions are misdiagnosed as other things. So it's hard to have really accurate data, which is why it's important to really understand what farm workers are exposed to during their day-to-day so that they can be properly diagnosed and treated. Exposure to pesticides and chemicals also puts farm workers' family members at risk. It can be residue from these chemicals can be on their skin and clothes and shoes, which can be taken home to their family members as well. So that was really a high-level brief overview of some of these issues and risks and hazards related to housing and the work that farm workers do. In these next two slides, we're going to take a look at the current labor rights and protections in place or lack thereof for farm workers. So on this slide, we're looking at minimum wage and overtime. So the National Labor Relations Act in 1935 created labor protections on a national level for minimum wage and overtime. Unfortunately, farm workers in the US were not included in this and do not have to be paid overtime for hours worked over 40 hours in a week. There are a few exceptions in some states that have really taken a stance to protect their farm workers, such as New York and Washington. They now have overtime laws in place for farm workers. There are also a number of exemptions that exist for minimum wage requirements in agriculture. Um, these workers listed here do not have to earn minimum wage. So livestock workers, range workers, piece rate workers who have worked in ag less than 13 weeks in the previous year, and also children under 16 who work for piece rate and on the same farm as a parent. So here we're highlighting the right to collectively bargain and workers' compensation. So the National Labor Relations Act forbids employers from firing a worker for joining, organizing, or supporting a labor union. Farm workers are excluded from this protection compared to other workers in our country. Thus, farm workers, they can join a union and organize, but they don't have any recourse if they're fired for organizing. So farm workers generally are also not guaranteed workers' compensation insurance, but this can vary by state. One exception here is for the H2A worker population. H2A workers must be provided with workers' compensation. And we did want to highlight child labor because this is a very important group to be aware of and is often overlooked. In most industries in the United States, children must be 16 to work, but in agriculture, children as young as 12 can work 7 days a week if school is not in session. So you will see many migratory farm workers traveling with their family members, especially in those summer seasons when school is out. They'll have their children and families with them. Hazardous jobs cannot be done by people under 18 in most industries, but in agriculture, teens 16 and up can do hazardous jobs, which means using heavy equipment and performing hazardous job duties. Teens aged 15 to 17 employed in agriculture are statistically 4 times more likely to die than teenagers in other jobs. So it's very important to be aware um, of farm workers and asking them who in their family is with them, who in their family is working with them, and identifying their family members and especially the youth and children. So now we've covered a lot of introductory information on farm workers, and now we want to talk a little bit about some of the strategies for strengthening healthcare access for farm workers. So I'll pass it over to Carlos to talk about that.
All right, thank you, Katie. So based on what we have discussed so far, let's talk now about how health systems actually can better serve farm workers. So let's actually move to the next slide. All right, so let's actually talk about strategy number one, expand access to healthcare services. Yes, it's this is nothing new, right? It's not innovative when you when you read that. However, though, the strategies that actually can be applied to this is, well, you can offer mobile health clinics that actually visit farms in rural areas, and there's already organization doing this. We can increase the evening and weekend clinic hours to accommodate farm worker schedules. Actually, Katie had mentioned that because of the schedule of farm workers varies. Some of them actually works in the mornings, some actually works in the afternoon, some of actually in the evenings. We gotta be able to actually look at that and make sure that the services that we provide are accommodating based on that rigorous schedule. We can provide telehealth services for follow-up visits and chronic disease management, where in cases where farm workers can actually are not able to actually go to the clinic, if we can provide telehealth services in which they will be using their mobile devices to actually talk to a healthcare provider, that actually would be great because actually that's one way in which you are actually reducing the gap that exists in order for them to actually have access to healthcare. When we talk about improving communication and language access, this actually means, and Vivian actually touched on this, hiring bilingual staff and interpreters for non-English speaking farm workers, right? That's actually um, a common one. If you are developing educational materials, and this is something that here at NCFH we do quite a bit, and so we use simple, clear health education materials in Spanish and indigenous languages, for example. Um, you also want to consider training healthcare providers on effective communication strategies with farm worker communities. So those are three things that you actually can do under improving communication and language access. When we're talking about reducing financial and logistical barriers, well, we want to make sure that we are able to provide a sliding scale fees and financial assistance programs for, for farm workers that is very hard for them to afford, healthcare services. We want to assist with enrollment in available healthcare coverage programs if they exist, and we want to offer transportation when we're talking about logistical barriers, right? We want to offer transportation support or bring healthcare services closer to work and housing areas. Strengthen workplace health and safety. Katie actually touched on this as well. And so we want to make sure that we offer health screenings and care for job related injuries and illnesses. We want to also educate farm workers and employers on preventing heat stress, pesticide exposure. And this is something that we actually do here at NCFH as well. We actually do webinars on these topics. It's one way to actually, educating our farm worker community, educating employers in regards to these topics is one way to also bridge the gap when it comes to healthcare access for farm workers. We want to also advocate for safer working conditions and increase access to protective equipment as well. We want to make sure that how farm workers that are able to conduct their job with safety and regulations, but at the same time, we want to make sure that they are healthy in order for them to actually do their job and at the same time earn the income that they obviously they actually need. When it comes to increasing outreach and community-based care, we're talking about training and employing trusted community health workers to connect farm workers with medical services, for example, right? You develop a relationship with this farm worker community, and having that bridge, having that community health worker is key because they are the one connecting, making that connection between these services and the farm worker community. We also want to partner with local organizations, churches, and agricultural employers to actually host health events. This is a great way in which you actually are promoting all your different services, the resources that you have, the farm worker community comes, and there's another way for you to also develop those relationships as well. And by doing that, though, you're actually building trust through consistent engagement and reliable healthcare services as well. Provide comprehensive and preventive care. What does that mean? Well, we want to actually ensure access to vaccinations, for example, including the flu, tetanus, and others. We want to expand maternal health, prenatal care, and child wellness services. For their families. We want to address chronic conditions like diabetes, hypertension, and any respiratory issues that are common in farm workers. So in other words, we want to make sure that we actually are providing the services that they need in order for them to actually be healthy and being able for them to perform their job. And then by supporting farm workers' well-being beyond healthcare, now we're actually talking about providing information on nutrition, mental health, and stress management, for example, right? These are actually some of the things that farm worker might be dealing with on a daily basis. And we want to be able to also provide services in regards to those issues as well. But we also want to connect farm workers to legal aids, for example, housing support, and worker assistance programs. And we want to partner with the schools and local agencies to support the health of farm working families. So one of the things that we're doing here is actually we want to provide a holistic framework in which farm workers actually have access to other services that actually go beyond healthcare. Now, and number A, what it says, share proven strategies, context, and material. This is about actually among organizations that provide services to farm worker. You can actually share with other organizations, with other partners, all the things that you're doing that are actually working. And at the same time, what you're doing is actually enhancing the process, improving the process to better be able to provide the services that the farm workers actually need to increase or to reduce the barrier when it comes to actually having access to healthcare. And so, we want, obviously, as we are providing this list, it's not a list that actually stops at number 8. It goes beyond that, but these are some of the things that we thought actually are very important. They are key in order for us, obviously, to provide great services to farm workers, and as well, it kind of actually provides a very strong foundation in terms of what are the first things that we actually need to take into consideration, and when we're talking about health systems that actually can better serve farm workers. And now I'm going to pass this on to Katie.
Thank you, Carlos. So this wraps up our session for today, and we hope you gained some foundational knowledge and understanding of farm workers and the farm worker experience and some strategies to consider for bridging the gap and accessing care and services that they need. We hope you'll tune in to the additional sessions to take a deeper dive into the specific industries within agriculture and how they're experiencing infectious disease, specifically H5N1 avian flu. So please join us for those sessions, and thank you so much for joining.